I'm David Soper. I'm the J. Marion Sims Professor for Obstetrics and Gynecology here at the Medical University, and I'm one of the CARES physicians. So we're talking today about the CARES Clinic. I got involved with this several years ago, and I really wanted to give back to the community. And I've always been an advocate for providing care to those individuals with poor access, and this really is the epitome of that. These are women who have no insurance and literally don't even have enough money to come up with a deposit to be seen even in our discounted clinics. At the same time, you're able to really one-on-one be involved in teaching preclinical medical students how to go about an initial evaluation and physical examination. And there's a tremendous amount of give back from the student to the teacher in that regard, because it's a brand new day for these medical students. It is so much fun to walk them through the very first clinical encounter. They don't know exactly the way to approach some of these, in my case, gynecologic problems, but with some guidance and with their enthusiasm, they do a really remarkable job. And it's great fun incorporating the student and the patient into what ends up being a universal learning experience. So I would say that I can really endorse your participation in the CARES Clinic. It's a great experience with very little pressure to run through a large number of patients because the volume is relatively small. And it's a great opportunity to introduce your medical students to an initial evaluation and physical examination, and to engage the patient in her own self-care as well as coming up with a solution to her clinical problems that she presents with. Patients that attend CARES really don't have alternatives. As I mentioned before, they literally don't even have enough money to come up with deposits for discounted care. And so they literally would be without any preventative care at all, and they would be without any opportunity to endorse a relief of their problems without going to an emergency department, which of course puts a tremendous financial strain on the medical system as you and I know it, and actually is a burden for them as well, because they end up waiting long hours and seeing physicians that they don't have a relationship with. At CARES, at least, the building can be a continuous source of medical care. The providers there are the medical students, which come back time and time again. As an attending, I'm there on a relatively regular basis and can enjoy some continuity of care for patients that need to return for follow-up. As you know, we're all very busy, and with our additional responsibilities to the medical university as well as throughout the community and even nationally, sometimes we're on the road, and so it's really helpful to have a group of individuals that we can be committed to care, so that we can all trade off and make sure that the CARES Clinic gets covered. I really highly recommend that you get involved in this project. It'll make you really feel good about yourself. I think you'll really enjoy, again, this educational opportunity that you'll share with preclinical students that really enjoy and benefit greatly by that one-on-one experience. And in the final design of things, of course, it's the patient that benefits most, because these patients are listened to, a diagnosis is made, and we arrange appropriate therapy or preventive services for them through the free CARES Clinic. I think you can make a real difference. You'll see more than just uncomplicated primary care, preventative types of processes. I think you'll see some out-of-the-way types of diagnoses that will challenge you to work up in a very meaningful but cost-effective way, and you can have a dramatic impact on these patients' lives.